I think if you can see on the camera there, you can see, so this is the optic nerve there. The optic nerve is where blood vessels enter the eye. So the blood vessels that give you circulation inside the eye enter from that point there. There's a bit of a design flaw in that the arteries and the veins come in sharing the same connective tissue tunnel that allows them to come into the eye. And they cross over each other as they kind of head different directions. And so at each of those crossing points of an artery and a vein, you've got a bit of a weak point there. And so retinal vein occlusions, the most common cause of retinal vein occlusions is high blood pressure, because the pressure inside the artery becomes so high that the artery squeezes the vein shut at that pinch point. You can get a little bit of a blood clot forming that blocks the vein completely. And so that stops blood from leaving the area of the eye that's supplied by that vein. And so if it's what we call a branch retinal vein, so a retinal vein that's out in the peripheral part of the eye somewhere, then it's just one area of the retina that becomes affected. But if it's the central retinal vein where it's going back into the optic nerve, then that can affect the entire retina and affect the vision generally. So, vein occlusions, it depends on where in the system they are, but the effect they have is the same, which is that blood can get in, but blood can't get out properly. And so what happens there is the pressure inside the veins and capillaries and arteries in the eye rises, and you get damage from blood vessels starting to leak, and you get damage from the retina not being able to get the blood supply it needs because the flow is interrupted. So it's usually not as severe as a retinal artery occlusion, which is like a stroke, effectively, where blood can't get in. But this has a similar effect in that it interrupts the blood flow, and vision is lost because of damage to the retina from a lack of blood supply.
So what are some of the treatments available to reduce complications when something like this occurs?
So we think about this in terms of what we need to do for the eye and what we need to do for the body in general, because the risk factors that central retinal vein or any kind of retinal vein occlusion have, they share those risk factors with other cardiovascular diseases. So, the major risk factor that we worry about, like I said, is high blood pressure, but it's also fed into by things like diabetes and high cholesterol. And in very rare cases, it can be because of inherited clotting abnormalities. That there are certain people who are predisposed to getting things like deep vein thrombosis and pulmonary embolism that can also get retinal vein occlusion. That's why we need to think about the patient in as a whole rather than just thinking about the eye. So, for me, when I see a patient with a vein occlusion, the first thing I'm thinking of is what could have caused this. If it's someone who's in the correct age group, so someone older than the age of about 50, who's got a history of high blood pressure and maybe where it's very up and down, then that's very open and shut. We know what the cause is and we can treat that. Just the same if it's a person who's got forms of glaucoma and their intraocular pressure is a bit out of control, that can do it as well. But if I'm seeing someone who's, say, a 34-year-old woman who's got no other risk factors, then that's a bit of a red flag to me that maybe this isn't just your standard vein occlusion. Maybe this is actually something that's related to a clotting abnormality. And so, we tailor treatment and our investigations things a little bit to the patient who's got the problem, as we all should as doctors. But step one for me is always, what do I need to do to keep this person safe from other diseases that could affect the eyes or could affect the rest of their body? And then step two is, what do we need to do for the eye? And so in terms of the eye, if there's no effect on the vision, then that person may have gotten very lucky that the vein occlusion hasn't affected a part of the central vision, in which case we may be able to just watch and allow the body to clear the blockage by itself without needing to do any active treatment to the eye. In some cases, though, the blockage affects the macula, and we can get swelling in the macula, much like we can with diabetes, in which case the treatment is the same. We do injections to try to settle that swelling down, knowing that the body will eventually clear that blockage on its own, but we need to protect the vision as much as we can while the body's doing so, because if we allow that swelling to sit there unchecked, there can be permanent damage to the retina before the body's able to repair the blockage on its own. And in some cases, we can get forms of new blood vessels growing, again, similar to diabetes. And in those cases, a combination of injections and or laser to get rid of those damaged vessels is the correct treatment. And in some rare cases, a vein occlusion can be so severe that it very badly damages the vision in a way that we can't fix, but also starts to cause a form of glaucoma, because you get new blood vessels growing in the front part of the eye that can put the pressure up, and that can result in an eye that doesn't see but is also extremely painful. And so we will sometimes be doing injections and laser to treat that condition, so that even though we might not be able to salvage a lot of the vision, we can allow someone to keep their eye and have a comfortable eye that still sees something.